Hello everybody, Andrea Twarowski here with Dentalelle Tutoring, and this is another patient edition file. So I have been a tutor now for 13 years and I love teaching dental hygiene and dental assisting students. I teach everybody online, so internationally. I started my own business when I was 19 and I love it. And I currently work in a dental office about twice a week, that's it, because I love patients, but I love teaching too. So I kind of do a little bit of both. And this is a common question that a lot of patients have. Or you might have this sort of thought in your head right now, but you're kind of afraid to go to the dental office. And that's about sore teeth. So you might be wondering, how do you get a sore tooth? What happens when I have a sore tooth? What can I do? You might be thinking, I don't have the money to get it fixed, so what could I do at home to alleviate the pain? And this is kind of a tricky question, so please hear me out because it depends on the type of soreness you have. Now, if your tooth is cold sensitive, it's probably not a huge deal. You might just have thinner enamel in that area. You could have been brushing too hard for several days, several weeks, several months, and now the enamel is starting to get thinner and it's being exposed into the second layer of the tooth. Or the gum has started to shrink away from the teeth a little bit and it is now exposing the root of the tooth, causing that cold sensitivity. Now, the good news about that is that if you buy a Sensodyne toothpaste, that will help that, because what it actually does is it helps to cover up the tooth that is exposed and it's not supposed to be, and then the sensitivity will become a lot less or go away. But you do have to figure out why the tooth is cold sensitive though in the first place, because it's not always that simple. If you're brushing too hard and that's why the tooth is cold sensitive, you do need Sensodyne to help with that. But you also need to stop brushing so hard, because even if you're using Sensodyne and you're still brushing too hard, then you're just taking away the Sensodyne and more enamel and more of the gum tissue. So it is a good idea to book an appointment so we can look at it for you and then let you know. If your tooth or teeth are really, really cold sensitive, there are things that we have in the dental office that we can apply to your tooth to make the sensitivity go away right away. So let us know. Now, if your tooth or teeth are sensitive to hot things, that could mean that the nerve of the tooth is starting to die or is dead. And how that happens is if you have a large cavity, you might have injured the tooth in some way. Those are kind of the main causes. And the only way to fix that is to come see us, so we can take an x-ray of the tooth so that we can look inside the nerve and see if that's what's happening. Because if that's not what's happening, then we don't want to treat it in that way. So we do need to know sort of why the tooth is hot sensitive, because it could be a number of things. And if your tooth is hot sensitive, it might mean that you need a root canal. And don't be afraid of that word, because I don't want you to say, oh, well, my tooth is hot sensitive, I'm not going to see the dentist because I don't want to need a root canal, right? It's not that bad if you need one. And if you leave it alone, then the tooth can become more and more sensitive and it can start to affect the teeth around it. So then your whole mouth at some point could become sore. And then if you see us eventually, we may have to actually take a tooth out if it's so far along that we can't do the root canal. So you actually want that before we take the tooth out, okay? So just come on in so we can have a look. If your teeth are sensitive to sweets, you probably have a cavity. That seems to be more often the case if your teeth are sensitive to sweets. Hopefully it's just a small cavity and that we are able to fix it up before it becomes too large, because cavities do not go away on their own, unfortunately. If you leave them alone hoping that they'll go away, they won't. They will only get larger. And then soon enough, you'll be in so much pain because the cavity is so large. Now, if the cavity is so large that it goes into the nerve of the tooth, it can then kill the nerve, and then you need a root canal. And you don't want that either. So come see us before it gets to that point, and then we can fix the tooth before it needs a root canal. But if you're in so much pain, you might need a root canal and you should see us anyway. So just come see us before it gets to that point so we can fix it earlier for you. Those are kind of the most common ones. If your teeth are sensitive to eating though, or pressure, you might have a crack in the tooth, and some cracks you can't see. So your tooth might look perfectly fine, but inside or near near the enamel portion, it could be cracked. So you want to see us when that happens so that we can seal up the crack before it chips the whole thing. Because if you're constantly biting down on a cracked tooth, it can chip at some point. And if your tooth chips so far along, we might not be able to save that chip or fix it. We might have to take the tooth out. Now that's an extreme case, but you want to see us before that happens. So if your tooth is pressure sensitive or only sensitive if you're eating something, then it could be a cracked tooth. Now, what else? Those are common ones. If your teeth hurt overall, like an achy kind of a feeling, especially in the mornings, you could be clenching your teeth at night. You could be doing, this. If you're stressed, if you're a student, you could be clenching at night while you're taking exams, things like that. In that case, you will need a night guard. And as soon as you wear a night guard, that pain likely will go away. Night guards are amazing, and a lot of people have them. Like 85% probably of the population, I don't know the exact number, has a night guard. So do not be afraid to get a night guard. It's easy. It's just something you wear in your mouth at night, and that helps to keep your jaw in a more relaxed position. And even if you are clenching, it's a lot harder to do so. But if you are, you're clenching the night guard and not your own teeth. Because if you clench too much, you can start to wear away the enamel and take away your teeth. Because doing this all the time will slowly wear things away, and that becomes sore too. And looks a little unsightly, for lack of a better word too, right? So you don't want that. I'd say those are the more common ones. In the more extreme cases, if you have a dental abscess, so a dental infection, you're in a lot of pain, come in, we need to see you. We will probably have to take an x-ray so we can see where the tooth is having the pain. Because even if you say the pain's over here, it could be the tooth over here that's sort of radiating that pain through. All three teeth could have an abscess technically, right? So we don't want to treat a tooth if it's not the right tooth. So we would take an x-ray, likely put you on antibiotics if you need that, and a painkiller to help with the pain, and then we can treat the tooth from there. So any dental pain, try not to look it up on the internet because that's a little bit scary. Just come on in, book an emergency, book an emergency appointment, and your dental office will look at that for you, and then you don't have to worry about it. You won't be in pain. So do not be afraid to come in, okay? So I hope that helped. If you guys have questions, please just let me know.